So for doing this procedure also, Shabab, for doing this procedure also, you have to use only galvanism and continuous mode. If you put galvanism in alternating mode, this won't come. This reaction don't come. So this is one of the exam. Okay, I'll tell you the question will be identify which is anode and cathode in this particular machine. That is the question. So you have to come, choose electrotherapy, all the current waveforms, choose galvanic current. In the galvanic, choose continuous galvanic current. Then go to the continuous galvanic current, set 10 to 15 minutes timing. Then put as the intensity more than 20 or 25 milliamperes and wait for 2 minutes. After that only you will see the reaction. So if you show me this, then you will get full marks. If you don't show me this reaction, your practical is okay?
Okay.
Sorry. Okay? So this is one. How to detect the anode and cathode. The next practical is how to use high voltage galvanic current. Okay? Anybody can tell me what are the uses of high voltage galvanic current? High voltage galvanic
50.
current. Yeah, frequency you are saying something. 1 to 120 pulse frequency, pulse per second. The voltage is 500. Okay, 500 microvolts.
Yes.
Okay, pulse duration
5
to
60
50 or 65.
65.
Okay, 65 is the timing for the pulse duration. What are the uses? For pain relief. Okay, and you remember I said for edema.
Yes.
When there is a edema, there are negatively charged ions in a hand or in the foot. So that time you have to use cathode or anode? Cathode, because the edema has negatively charged ions. So you have to use cathode to decrease that particular edema. Wherever edema you are going to treat, that time you have to treat with the cathode. Okay? But other causes like pain, muscle spasm, that time you have to put anode as the active electrode or anode as the major electrode. Okay? So for doing galvanic stimulation or galvanic current treatment, what all things you require? You don't require all these things. Okay? For galvanic stimulation, you require materials, machine, towels, the leads, electrodes, water, your pads to cover, okay, then the strap to tie to the patient. So this much only you require for the galvanic treatment. So after this particular collection of the material, if anybody want to come, they can come as a model. We'll treat for only hand. Yes. Okay. Again, in the clinicals, when you see the patient will come, I have pain here. Okay? Pain here, and I want to get the treatment. So if you try to choose galvanic current as your treatment, then on the pain area you have to give anode. Okay? On the pain area you have to provide anode. So wrist pain means, again, communicate with the patient, rule out the contraindications, any fracture, any injury, any carcinoma, any pregnancy. Okay? You have to rule out all the contraindications. After ruling out the contraindications, you make sure that there is no problem. Okay? Then because it's very good question. Why anode? Nobody is asking. Why anode? Okay? Because anode has positively charged ions. These positively charged ions will go into the body and they can stimulate the blood circulation or blood vessels better than the cathode. So whenever the anode has stimulation capacity of blood circulation, the blood circulation will improve and the tissue will heal better when you use anode than the cathode. Okay? So that's why you have to choose anode. So now the procedure is same for all the procedure, however you are doing. Put your electrode onto the area of stimulation. Do we need to put water on the skin?
Yes.
Why? Why we have to put water on the skin?
Continuous.
Because it's dry.
Yeah, it is dry. So there is a resistance for electrical current. When our skin is dry, there is a resistance for electrical current. So current don't go smoothly into the body. So to decrease the